Hi, you're listening to Collectively Speaking by the Birthday Collective, a bottom-up initiative to develop ideas about Singapore's future. Welcome to the space where birthday book alumni have conversations about the things that matter to them, to us, and to Singapore. We hope that you will be a part of the many conversations we will have, or perhaps to even start your own. And now, onward with the episode.
Hello everybody, my name is Cherie and I'm your host for today's podcast, Generation C19, The Chaos and the Quiet. Today in the studio with me, I have three guests, Dr Kenneth Koh, Tim Loh and Gladys Wee, and I'll leave them to introduce themselves.
Hi, my name's Kenneth and I'm a GP. I'm also husband to my wife Hui Lin and father to my 2-year-old daughter Emily and a 5-month-old Matthew.
Hey, I'm Tim. I am a nonprofit executive working in a charity that works with leadership and entrepreneurship. And next to me is my wife.
Hi everyone, I'm Gladys, a mother of a 7-month-old Cadence. Same Cadence Tim was talking about, and Tim is my husband.
Hi, and I'm Cherie and I'm one of the editors of the Birthday Collective. Generation C19 was a project that the Birthday Collective started just as the pandemic was kind of heating up in its early stages. We felt it was important for us to capture the stories of this time. And all my three guests here, actually, they wrote for this project. Can you tell me a little bit about your essay, if you can?
Well, when Cherie first approached me, it was a time where I was working in the dormitories. And she asked me to, pen down some of my thoughts and feelings around that time, some of the challenges that both myself and our family faced, and especially given that we had, as a family, we had decided that I would move out of the family home just for that time being to for safety and just as a precaution as my wife was pregnant.
And Tim and Gladys, tell me a little bit about your really interesting essay.
We wrote that as a collaborative piece to sort of chronicle the birth of our child at some would call the peak of COVID.
Gladys, what are your thoughts about your essay? And now that you look back, 7 months down, 8 months down?
Just the day that I delivered Cadence and the many restrictions we had. For example, I had to wear my mask throughout the thing.
Throughout labour?
Yeah. Even when I had contraction pains, so I would secretly take it off when I left the room. I was already in so much pain, still have to wear a mask. Thanks.
I think what was interesting for all three of you actually is that you guys had a pregnancy. I mean, not with each other, of course. In your case, yes, Tim and Gladys with each other. It must have been hard actually to weather this period. I mean, pregnancy itself is fairly stressful. Mm-hmm. What was it like for you actually, Gladys, to...
I actually had this crazy 3-month-long fever from starting in February all the way to April when I delivered. So I did 1,000 blood tests, x-rays, heart scans, is that what's called heart scans, and then almost had to do an MRI, but nobody could figure out what was going on in my body. No one knew where the fever came from. So until now, it's still a mystery. But I mean, the baby is out safe, so I guess all's
tough.
good.
It's tough to have fever during that time period as well.
Correct.
Yeah. Tim, what was it like for you? I mean, your wife is not well. Clearly, there are all these symptoms that you can't tell amidst this crazy coronavirus pandemic. What was it like being a husband, and at that time an impending father, and then a father?
I think what is not often addressed during that time, during that build-up towards our circuit breaker, was also how much was going on at work, right? Where there was a lot of uncertainty. No one knew whether we were going to stop working. No one knew whether we had to work from home and stuff like that. So for me, much of it was the balance between what I would handle at work while also dealing with what's happening at home. So pregnancy, first of all, the pregnancy, as Gladys alluded to, was already a really difficult one, COVID notwithstanding. what COVID presented was just a lot more difficulty in getting medical attention. And I guess rightfully so, right? Because like the medical attention is turned directly towards a pandemic. When she had this fever that just persisted through, the GPs just were super confused, didn't know what to do. GPs kept referring to hospital, but you can't go in a hospital without actually making yourself seem like a suspect COVID case. And so I think that was mainly the difficult part, right? It's that determining what's a pregnancy issue and what is a COVID issue. And then for me, it's really just staying strong as a support for her, because it wouldn't make sense for me to panic and then make her feel that same panic. So from my perspective, it was just largely that it was a very tricky balance for me.
And kind of you actually lived kind of both, right? You were in the front line, with your clinics and with swabbing, and then you have a wife who's pregnant, kind of in a separate home, alone with her young child. How was that for you guys?
Yeah, as Tim very correctly pointed out, it was a very, very uncertain time for all of us as doctors, as society in general. I mean, there just wasn't information, and no one knew the effects of COVID on a pregnancy, on the fetus, and we struggle as well, to decide what was the right thing to do, and to take appropriate measures to help reduce the risk of transmission at home. For us, it was quite a fluid time. My clinics were one of the first few to actually see COVID positive patients in when it first started, and things were very fluid in terms of protocols, making sure the other patients were kept safe, and contact tracing. And then when the dormitory situation got a bit more heated, that was a time when the government was looking for volunteers, for doctors, nurses, healthcare assistants to help in the dormitory medical posts, and that was when the decision became a bit more real, because the risk levels were obviously higher than working in a clinic, and that made us focus our attention into what measures I myself as a doctor, as well as someone coming home every day, would have to take just to keep everyone at home safe as well.
So what was it like having that conversation with your wife? Like, oh, honey, guess what? We saw the first COVID patients, and I'm going to the dormitories in the front line. That must have been hard.
Yeah. Well, to be fair, it was about 2 months apart. From our first patient in Singapore to the dormitory situation getting more heated. But at that time, there was a gradual increase in information and awareness of what was going on in Singapore. But at the same time, bringing up the conversation with my wife was a difficult one. It was to her credit, and she's been a real trooper through all this. At the time, she was about 6 months pregnant. My daughter was about 18 months old at that time, and we had just moved out, so we were living by ourselves. So we didn't have much support. Singapore was in lockdown, and no one was allowed to go out. So being able to get support was obviously tough. So for her, the main priority was, of course, making sure that she stayed healthy and the baby was healthy as well. But at the same time, we were also, struggling with what was the right thing to do. We were lucky in that, had a ready place to move back into. We had just moved out, and we hadn't sold our whole apartment. And so, after discussing the pros and cons, the risks, and so what needed to be done. We made the joint decision to for me to move out temporarily, and I moved out with some colleagues of mine who were stuck in Singapore because of the Causeway lockdown.
COVID has actually been punctuated by a lot of tough choices that we all had to make. On day-to-day work, parenting, teaching, they're all hard anyway. But I think COVID kind of accelerated or intensified this sense of having hard conversations. What kind of hard conversations did you guys have, Tim and Gladys?
I think the main thing that I can remember was how we weren't able to have our parents come over. It's more of how do we say no, right? How do we do the right thing to say, I know it's only the four of you, but we are under lockdown and you should not come and see your first grandchild. That was tough. There were also conversations that we had to have still with parents about issues like having a confinement nanny, whether that was safe. How would we get the necessary items for Gladys's confinement? There were all these things that popped up that I think in hindsight, I don't think that they were super difficult, but I guess in that moment, it was just another blip that we had to deal with, which we just thought was unnecessary.
In pregnancy, I mean, being a new parent always feels very chaotic. I mean, it was for me anyway when I had my first kid. What was it like, I mean, for you to have that to deal with, this newness, and then this juxtaposed against this, landscape of really deep uncertainty?
Honestly, I was just really glad that I had my husband with me most of the time, because he was and is still working from home a lot. So anytime I was overwhelmed, I would just dump the baby to him for a while. He would take care of her. So that support was really important for me up till now. It's been 7 months, so I'm just really thankful for that.
So Tim, are you still working from home? I mean, or you
Yeah,
still
we're
have
doing
the
half
option?
and half.
Okay.
So I do head down to the office, and truthfully, that's kind of my escape. When I can go to the office, that's my escape. Which makes me further appreciate what Gladys is doing, because I might have that escape, but she does not. And she hasn't had it since like more than a year now. So I think that is it is something that I guess I wouldn't say is silver lining per se, but it is something that helps me appreciate even more what mothers are doing, and appreciate even more that we have the opportunity to balance this out.
And parenting is hard. I mean, kind of, you've been parent for 2 over years now, and parenting is hard on any given normal year. Parenting during COVID just feels like an added layer of crazy, right? I mean, what has it been like for you? I mean, you before and during. Has it been different interacting with your daughter?
Well, it's not easy to have a good point of reference, because if you've only got one older child, and she's only been 2 once so far. But I think just comparing what I would have thought parenting would have been, under in normal circumstances, I think social distancing, wearing masks, not being extra careful about touching, things outside, and washing your hands. Those are all things that I think we wouldn't have thought of, 2 years ago for sure. I think knowing that the disease can still, Singapore's been very lucky in the sense that, it's been quite contained, and I think we've been lucky that, life has more or less resumed to almost normal, some semblance of normality. I think with Christmas coming and not being able to have big gatherings and seeing, big family gatherings especially, I think that's one big thing that we're all missing out on this year especially. But yeah, I think rest of the time, I mean, on a day-to-day, we go to school, we come back, we go to the park. I think things have luckily and thankfully kind of resumed to a certain sense of normality.
I think for a lot of us, and I think I speak for the 4 of us in the studio today, that we appreciated the crazy and the waves that happened, and then now we're kind of like enjoying this easing off. And during that time of chaos, I think, and I use that word, I don't think as lightly as I think it actually would mean, because it was kind of chaotic. There was a lot of uncertainty and unknown. If you look at Singapore as a whole, there were a lot of fervor, what people talked about amongst parents, amongst people, amongst frontline workers. And I think for Kenneth, you especially, you and your wife made the decision to act, to take part in some sort of like, we'll step in whatever needs that Singapore had. And I think people don't often forget that when frontline workers make that choice, it's not just them that's making the choice. It's an entire family unit that makes that choice. And then just earlier we talked about hard conversations. But what made you feel compelled to do something? I mean, what was it that you and Hui Ling felt as a family that yes, daddy/husband would go, into the front lines to do this?
Well, I think part of it is being what I do at work is sometimes necessary. I mean, in terms of helping society in whatever way I can. I think that's all. I think everyone, that's all our country and our society can ask for. I mean, we try our best, and that's what it was for us, I guess. To be fair, not so many philosophical kind of questions. It's just like, okay, it's work that needs to be done there. What are the risks? What are the what's the worst that could happen? And just trying to keep everyone safe while we're doing it. And I think for a lot of us in hospitals and in clinics, it wasn't so much of a choice as a matter of this is our duty, we need to do it. But of course, we take the appropriate precautions in whatever way we can.
I mean, I never knew this. I always thought every doctor could take part, and I realized I only after talking to you during COVID that I realized that not everyone who is medically trained can actually volunteer for like frontline work. Am I right?
Yeah. I mean, I think those that have pre-existing medical conditions, slightly older medical staff, I mean, they would have put themselves in even more risk. Because I was lucky that I didn't have any of those, and apart from Hui Lin being pregnant, I think, and I could isolate myself anyway. It wasn't too difficult a decision to make, apart from her being alone with the kid.
I mean, you obviously felt compelled, and you were on the ground seeing a lot of COVID unfold. And you shared in your piece on what it was like. What do you think COVID has given back to society? I mean, people have said, COVID, for all that is taken from us, has also given us a lot of perspective, perhaps, a lot of, it has uncovered many things that we can now begin to fix. What positive things has COVID brought about for you in your work and your family?
Well, I think for society, it's kind of spotlight on the migrant workers. I mean, specifically for Singapore, especially the migrant workers and the part they play in helping build our buildings, our infrastructure in Singapore, and sometimes unrecognized or previously unrecognized job they've had in terms of building up our country. I think. Amongst Singaporeans, certainly Singaporeans around my friends and family, I think we all have a greater understanding of what the dormitories were like. I mean, I honestly had never stepped in a dormitory before all this, and having that kind of perspective has helped me personally and us as a family and colleagues as well. Just understand what the struggles they go through as in helping build our country. I think that moving forward, we do need to help integrate, the work they do. They may be visitors to our country, but I think it's our job as Singaporeans to make sure we're good hosts.
So I think what we're hearing is that it's given us more empathy and more awareness. Tim, in your work, you work with youth. A lot of your programs, I know, at work have had to take a real pivot. How has things been better because of COVID?
So I'm just going to repeat what I tell my team all the time, which is what COVID has presented us is not merely a limitation, but lots of opportunities for us to accelerate lots of things. What it definitely has accelerated in the view of education is that it's made digital, virtual now so normal that what has happened over the past 1 year was something that the whole edtech industry has been hoping happen for the past 5 to 10 years. And that is an opportunity because it means that we can now reach more people who need education, whether it's academic education in the most standard way of things, or is in a kind of character education that we do at our work, soft skills, leadership, and providing access to that because of what this pandemic has driven us to, right? To being behind closed doors, only being able to access through a smartphone, through laptops. all that has been so useful in the grander scheme of things, because what we can expect 10 years later is a generation of young people who would have, more than any other generation before, access to quality education. And I think that while we're struggling with it today, we will look back at this moment and go, if this didn't happen, we wouldn't have the educated populace that we would have across the entire world, really, 10 years later.
Gladys, what has COVID given you that as a person, as a mother, as a wife, and as an educator, what do you think COVID has allowed you to do that you wouldn't have had the luxury of if it weren't for this crazy time?
Probably time with my family. I'm appreciating my family a lot more now. I remember when I just gave birth, it was during the peak of the pandemic, and so my mom couldn't come over to help me. And I remember feeling very helpless and alone, even though I had a nanny, but nothing like a mother's help, right? So, like, she would leave my confinement food outside my gate and just go. And she knew full well that the baby was just a couple of steps away in the living room, but she couldn't even open the door and see the baby. So that whole episode has made me really appreciate family a lot more. Yeah.
What kind of conversation do you think we will be having? What conversation do you think we need to have because of your time in COVID? Whether it's because of your pregnancy, your mothering, and your time with your family. What conversations do we need to fight to have or have with the rest of our generation and the generation that comes after us about this time?
I think we need to talk a lot more about the mental health of new mothers. Because of the lack of support I had, because my mom obviously couldn't come and help me, I think the lack of support can really take a toll on the new mother's mental health and well-being. So I think we need to have more conversations about this.
Oh, Tim, how about you? What kind of conversations do we need to have?
This might not be COVID related, but because I'm going through this at this time, it is worth noting, because I'm looking at my experience as a new father, and having spoken to a few of my friends who are new fathers as well, nothing prepares us for this. You know, the milestones are basically, your wife is pregnant, you celebrate, you support her for 9 months, and then suddenly your life change. It's like there is no build up. Whereas maybe for mothers, then there would have been that 9-month sort of build up towards seeing their body change, feeling their baby grow, building up towards this moment where they finally become a mother. But for fathers and for men in general, we work, we continue doing what we're doing, and then suddenly on one day we have another human being that we have to take care of. And life just turns upside down. No longer can we spend all those hours at work. No longer can we do after work engagements, after our engagements. Your social life takes a hit. And all that is, if we can't deal with that properly, we default to our natural state. And our natural state is go to work. Let's just do more at work. And we fail to provide that support that is necessary. And I think that perhaps a conversation that we should be having is, how are fathers preparing themselves for this? How do men go through almost this rite of passage for them to feel like they are ready to not just father, but to also support, to be a part of this family that does not simply consist of, hey, I'm bringing the dough home, I'm bringing the money home, but that really entails being there through the growth of your child, supporting your wife through it all, and really taking this as a team. I don't think that we have enough of that. At least this dialogue and this conversation is not commonplace. And maybe this is something that could actually erupt from this time.
I also think it's fascinating that a lot of new fathers, first-time fathers, or even second, third-time fathers, especially those who get to work from home, are actually being part of the confinement process along with mothers. I mean, usually they take paternity leave, right? Maybe a week if you're lucky. And then for the rest of the time, the mom's kind of on their own. Oh, what an interesting perspective. Kenneth, how about you? What kind of conversations do we need to have?
I think as Gladys also mentioned, I think being isolated and with social distancing and masks and not being able to hug someone, pat them on the back, shake their hands, or I think that has played had a toll on one's interactions with one's loved ones and building up relationships amongst each other as a society. I think we must be very careful and work extra hard into making sure that we don't miss out on building relationships, and we as a society make sure that we watch out for our neighbors, for people that are isolated, and make sure that we don't let them slip through the cracks.
I mean, I think for all that COVID has given us, I think to me the biggest thing that we got from it is that we started to have conversations that are not just chatter, conversations that matter instead, conversations about the hard things, conversations about the tough things, about what needs to be, what must be instead of what is. And I think that to me was, the most powerful takeaway I have had during this time. And on that note, I want to thank all three of you for writing for our project, but also for sharing your thoughts and your experiences and your vulnerabilities, and I think that's what really is truly valuable about this time in our lives. So thank you guys very much.
Thank
you guys for listening. Please go to our website if you need to read their essays, and we hope you have a good time and a good conversation with the person next to you. Thank you.
Thank you.
Thank you.
Thank you for listening to Collectively Speaking by the Birthday Collective. We aim to be a brain, heart, and hand trust for Singapore, focusing on the gifts we can offer to future generations. To find out more, visit our website, thebirthdaycollective.com, and follow us on Instagram and Facebook at The Birthday Collective. If you enjoyed this episode, do subscribe and drop us a review.